following program is a production of Hōʻike Community Media.
If you didn't know it already, that's a Byron way of introducing. We're about to start our reading. So for those of you who haven't had more than 4 cups of coffee, please sit down. And by the way, we now have wonderful cookies, which are being provided courtesy, of course, of our restaurant. And so help yourself. I felt it, since it was the first time they were providing those cookies to us, I felt a personal need to go up in there, test them, make sure that you all were getting quality. And they are quality cookies, so please feel full. Okay, a few items. First is, I was hoping that as of today, our web, and I'm sorry, I'm standing right, kind of, it's okay. So, my hope was our brand new website was going to be up today, but I don't think it is, because when I was checking our future speakers, it said 2024. So it's almost up. I know you're just looking at one tiny little thing, and it will be out. The reason I bring that up to you, a brand new website costs money, and what they have since maintain the website for the coming year, so we don't have issues with we value the past. So you all renewing your $25 a year free would be appreciated. Okay. Let's see. Do we have any community announcements from anybody through Mentor? Come on. Yes.
Let's just do my new calendar. I think here's okay. $8,000 from the groceries with all broadcast. So their community meeting, public radio, community fund drive starting right now until September 21st. The Tropic Care media, but I'm in character town, so you're supposed to be all this, that's what's like radio. You get there not over.
So if somebody shows up with a big check on September 22nd, will you accept it?
7th is the last day on Broad Guy and assault. Maybe. Yes.
Eagles and Willie Nelson.
Oh yeah,
right.
On our wall, not on the website, yes, but I mean, it's why with the option because the amazing the option of like concert tickets to Willie Nelson, to the Eagles, to Def Leppard. We have all sorts of book prizes and anything like that. And if you will have a business that has a gift to give Interview Radio, that is as an incentive gift, I'm here for you.
Your organization is not the only one I won't raise it, but there's another organization here which is also suffering from a feature of a drop in their federal support. They want to make that announcement. They can, but if not, I'm not going to bring it up. Yes.
The area called the Education Cruiser. I have an announcement on
What's
our employee workforce summit next week, Saturday on the 5th, out of Dominic at Jackson. And we are expanding the invitation for SAV who want to fly over. We'll cover their travel. So if you're interested in this, afterwards. And what one was for our Eagle Air Center out of the job, the A Center Foundation. They're playing the couple here to do to the sessions on Wi-Fi, and they're looking at having WR with diabetes for Gallon Evers. They go and start sharing for you if you want to do an informational session with them. So it's just a gathering. There's
no, I agree.
The kayak. One is at the Bakaluna on the 21st and 2nd, and I'll put more some that cheap day. So if you need information about registering today, yeah.
Thank you. Other community announcements? So I'll ignore anybody who is there. Okay, going once, going twice, okay. Let's see. Zooming on. I don't really have anything more. Okay. Especially since we have 3 speakers, I'm going to go ahead and move forward. As I apologize, what I've learned is I actually keep all the names here because somehow when I stand up in front of an audience, I have a tendency to have problems remembering everything. Janet Berryman, she's been to this meeting on several occasions in the past. Jen Chahanovich, like said that largely correctly, and like Sagawa, all that thing that they talk about their own individual organization, obviously talking about the future, medical care in medical stuff, and Hawai. And if you all don't have any questions at the end, I have one question, you know. And with that, just most important, the shells of finding, you know, where there's you there. Hold on just for all the working. Right, okay. Who's going to volunteer to be first? That's for the speak. Okay, I'm going to start with Jim. You are going to say? Better this. Well, if I turn them on for her, actually, I'm going to turn it off. Okay, so my preparation.
Well, thank you very much. Thank you for inviting us, and thank you all for being here. Can people hear me okay? Great. Janet Berryman, I work for the State Department of Health. I'm the District Health Officer for Kauai District Health Office of the Department of Health, which is a mouthful. Jen Chahanovich is the CEO of Wilcox Medical Center, and Lance Sagawa is the CEO of the HHSC hospitals, which are Samuel Makelana and KBMH. And we were asked to talk about the future of health in Kauai, and I'm going to say health instead of medical care because public health is what I do. As a context setting for this, we wanted to say that when we think about health, we think about overall well-being is what we mean by health, and that includes physical health and mental health and the integration of those. And so that's the perspective that we'll be bringing to our comments today. And because this is the Business Association and it's a little bit of an unfamiliar audience for us, we also wanted to connect the dots and say that a healthy community is good for business because healthy people are better workers, they're better consumers, and they make our community more appealing to visitors and residents alike. So we appreciate your interest in this topic. And a healthy Kauai is all of our kuleana. It's not just the hospitals. It's not just public health. It's all of us. And so we really appreciate your being here. With that said, Jen and Lance are each going to talk a little bit about opportunities and threats and what they see going forward from their perspective. And then I'm going to come back and do the same about public health and wrap it up. And then we have time for questions. Thanks. Jen?
Okay, can you hear me? Good morning. Happy to be here today. And really excited to be here with Janet and Lance. We work as a team, we work together, and we're very proud of that. My glass is always half full. So I'm going to talk a little bit about threats. When you talk about threats, there's always opportunities. So one big, beautiful bill that was signed in July of 2025. I am not an expert on that whatsoever, but there's some threats for Medicaid, but there's also opportunity in that. One of the threats in Medicaid for this bill is eligibility. And I'm sure all the details are being worked out. So I'm not going to get into any of those, and you can add when you talk. But the opportunity also is there for rural health. So the governor is working on that with a team, and so more to come definitely on that one. But there's definitely opportunity and a lot of it. Next one I'm going to talk about is opportunity, opportunity, opportunity. How many people here, and don't raise your hands because I'll be embarrassed, how many people here have a hard time sometimes getting an appointment with a PCP? Don't raise your hand. Close my eyes. So we understand that and we know that. So working together as a state, as a county, we're going to have the first Family Practice Residency Program on Hawai. This is so exciting. And this is not going to happen in 2030. It's going to start happening in 2026. We have been fully accredited for 12 residents. Yay, you can clap for that. And this is for the county of Hawaii. It's not only going to be at Wilcox, but it will be at KVMH, they're going to be with Janet, Department of Health. And so our first 4 residents will start July of 2026. They're going to do their first year on Oahu. This is a very unique program, and the reason we want them to do it on Oahu is because they'll have more opportunity to do procedures, see different things. So then the first 4 will be here in July of 2027. They'll always have 8 at a time on island because there'll always be 4 new residents coming in. So I have a real date for you to hear. July of 2029, we will have 4 family practice doctors on island. So that's very... The next program that's going into its 4th year is the medical students. This is the Chan Zuckerberg initiative. So the first year we had 6 medical students. That was the first cohort. Second cohort had 6. Third cohort had 4. And now we're going into our 4th cohort, and there are going to be 6 students of that. So it's a 5-year initiative. So we've got a 5th year coming. These medical students can choose anything they would like. They can be psychologists, psychiatrists, they can be a surgeon, they can be emergency room, they can be oncology. They have to give back, when they're finished, 4 years on Kauai. And by that time, they're going to be rooted. You know, if they move to Kauai, you're going to stay. Like, they're just going to love us, and I know it. But it is all of us in business. I was excited to talk to you because it's all of us that have to work with these medical students and these residents and make them feel welcome. So my glass is full now after talking about that. So I'll hand it over to Lance.
Thank you, Jen. Oh, good morning. Opportunities being the theme for today's talk. There's so much happening at our San Mauna Memorial Hospital campus, but in partnership with the Department of Health, Dr. Kenny Fink, we were able to acquire 14 more acres. So we have close to 50 acres to work with the main campus and some adjacent land. And some really good things are being discussed about what we're going to do with all that land. And it includes housing, different types of housing. Now, one particular theme that's been coming out really loud and clear over the last several years has been behavioral health. And if you take a look at the community health needs assessment just completed by Wilcox, you're going to see this constant theme that in our community, behavioral health services is very needed. And so we have, the last maybe 3 years, made a real effort to build up our behavioral team. We do have the only inpatient behavioral health facility on island. And so with support from the legislature, we are going to be constructing a new facility, which will give us much more, I think, resource to be able to deal with this issue on an inpatient basis. But we also have an initiative to build up our outpatient programs. And so as of today, we have 9 behavioral health clinicians on board. We have 1 psychiatrist. We're interviewing another psychiatrist soon. We have a bunch of LCSWs, counselors. We have an IOP program. We opened up the first behavioral health clinic in Lihue. Now, what I really want to emphasize is all of these initiatives and efforts have been, believe it or not, in coordination with Jen in terms of what we're going to focus on versus what Wilcox is going to focus on. And we made an agreement that it made sense for us HHSC to really focus on behavioral health because we have the inpatient facility. In the future, we're looking at residential treatment for adults on the campus, and we already have a site selected to support workforce housing. We've identified space on campus, and this will impact our family practice residency because we'll be able to provide housing for the residents coming through, because we all know housing is such a big issue for us.
Yeah.
But really, I want you to know that we are looking at ways to fill all the gap areas, and behavioral health is a really major one for us. Our only psychiatrist currently, Dr. Kaleka, he's been on board for a little over a year. He's booked out till January. He does not have any more capacity. And what that means is there's just so much need in the community. We are getting referrals from all over the island, and we're doing our best to fill it. We do plan to hire one more psychiatrist to really kind of beef up our outpatient capabilities. But it's really a major area for us, and it covers the entire spectrum of behavioral health, which is addiction, mental health issues. There are issues that arise just from pressure and stress. It's the whole gamut. And I don't know where we're going to end up in terms of a total number of team, but I can tell you that we're going to do everything we can to meet the need as the need arises. So that's our behavioral health initiative for the future.
Yeah, thank you both. I told Jen and Lance that they had to provide the optimism this morning because from public health, it's a little hard if anybody's been reading the news in the last 24 hours. But I do think that one thing that I want to highlight is you just heard two hospital CEOs sitting up here. Arguably, they're from competing organizations, and they talked about collaboration, they talked about education, and they talked about housing. And I think that that's a good example of how Kauai is different and where the optimism and opportunities do lie going forward, in the sense that we're all in this together and this is a partnership. From a public health perspective, we always think about what are the upstream things, what's driving the need for health care. So at the same time as we are interested in augmenting and enhancing and making sure that our healthcare system is adequate to meet the needs of our community, we're also thinking about what are the things that we can do in our community to decrease the need for healthcare, to keep people from getting sick in the first place, to keep people from reaching a crisis point or having an illness or a mental health illness. And I heard Lance say stress. Excuse me, if somebody could give me some water, that would be great. So I wanted to talk, I am going to start by talking about threats a little more than Jen or Lance did at the local, state, and national level. So at the local level, we know that the things that drive ill health in the sense of overall well-being, physical health, and mental health are largely the conditions in which people live. So the fact that our cost of living is high, that our wages don't allow many people to subsist on one income, that housing is prohibitively expensive, those are all things that are drivers of health in our community. And I see those as threats to the health in our community going forward. And I know that all of you are acutely aware of that. Kauai is a hard place for people to make it economically, and that creates stress in their lives and stress to their families and ultimately ill health and their overall well-being. So I'm glad that you are all here and all of you are part of the future of health in Kauai, even though you may not think of yourselves that way. But at the state level, I think there's a little bit less threat. We have a physician governor. We have a very strong health state and a history of being very supportive of health and of Medicaid and of healthcare. And that's a real strength for all of us. So yay, lucky we live Hawaii. At the national level. So the last 24 hours have been a level of tumult in the Centers for Disease Control that we haven't seen even in the last 8 or 9 months of tumult in the Centers for Disease Control. The director may not have been fired. 4 top leaders have resigned, basically as a statement of principle that they are being asked to uphold guidance and support guidance that is not based on the best available science. And what this adds to the recent activities, what I was going to talk about before the news broke in the last 24 hours was the Advisory Committee on Immunization Practices and the U.S. Preventive Health Services Task Force, both of which have been gutted and removed from following science and instead are following beliefs, if you will, or preset mindsets. And that doesn't have a big impact on all of us right now. But as we move forward, local and state health departments don't have the infrastructure to gather national data, to review scientific work that's going on nationally, and collate those, analyze those, and come up with consensus guidelines. And that's hard work. And those committees do that with a lot of disagreement and working hard to figure out where the best information is that we have. And that's not going to continue to happen. So the guidance and guidelines that we have right now are the only science-based ones we are going to have as we look forward into the future. And as I was driving in here with my husband, I was trying to think of the analogy. I don't have the perfect analogy, but it's kind of like we're building a house and you have your tools and equipment and you're told, that's fine, all those tools and equipment, you got it, you go ahead. But anything needs to be replaced, sharpened, recharged, need more nails, not coming. All you've got is what you've got now. So it's okay for now, but the long-term implications I think are really concerning, and I don't know what they look like, but I can't be optimistic about that right now. It looks like local and state health departments are going to be on their own, and largely and increasingly as we go forward, and not just financially, but in terms of knowledge and information. So we aren't getting the kind of information that we used to get about avian flu nationally, measles nationally, mpox nationally, all of these other things. And that's concerning as we look forward to our ability to do our job well here. So I don't know what we do about that right now, but I do think it's important for people to be aware that public health is really going to be operating without the foundation that we have relied on for a long time, for generations. Globally, as a public health person and living on our island, I have to make a comment about climate change. Changes in weather patterns, changes in the distribution of communicable diseases and vectors. Those things are real for us, and we're going to see them here. And with the undermining of the Centers for Disease Control, we will have less advanced warning and less knowledge about what's coming our way. So that's a challenge. Okay, can you guys, some optimism here? You want to stand up and cheer? I don't know. But I will say, locally, in terms of opportunities, our local Kauai District Health Office has amazing capacity. And in the face of all these challenges, we will do absolutely the best we can do for you. Sorry, gosh, I want my health department folks to stand up. Okay. Anyway, I brought the cheering crowd. Maybe you guys can provide some optimism. We're creating in the district health office a new section called the epidemiology and information section. And we actually envisioned that a couple of years ago in the wake of the pandemic and requested from and got from the legislature 8 new positions for our district health office, new created permanently in civil service. And these are not threatened by current federal cuts. And that is astonishing. So mahalo to our legislature for that. And that new section gives us an epidemiologist, Grayson, sitting over here, who can do his very best to help us find and analyze and interpret local data about health and health trends here on Kauai. And that's a capacity that we felt like we needed after the pandemic. We had no idea what was coming and how critically important that would be now. So I am extremely grateful that we are able to add this capacity. But this new unit is not just an epidemiologist. It is also community outreach workers, community health workers, public health educators, and epidemiologic specialists. All of these are people who can help us hear more directly from our community, be sure that I think that our health department here on Kauai is small and mighty. We work with all of you. That's why I've been in these meetings for years, to have opportunities to interact with folks that health departments may not normally do. And I work incredibly closely with Jen and Lance, and the partnerships that we have on this island are my strongest reason for optimism. So I do feel optimistic when I think about that. One more thing, and then I'll stop because we want time for your questions. Jan and Lance and I are part of something called the Kauai Wellness Partnership, which some others of you at this room are part of too. It's actually a multidisciplinary group that my predecessor, Dr. Paul, started to support the Wilcox, which is our nonprofit hospital, in implementing, if you will, the findings from the community health needs assessment that the hospitals are required to do every 3 years. So we have health folks, the mayor's office, all of our educational institutions, the Chamber of Commerce at the table, meeting about quarterly to talk about what are the needs in the health needs in our community, and how can all of us together work to improve health in our community. And that also is something unique to Kauai and a real strength of our community. And I think it will serve us well going forward. The newest community health needs assessment was just reviewed with that group last week. And we're meeting again to look at our priorities. The priorities of that group have for the last several years been workforce development, financial literacy with local procurement of goods and services, and behavioral health issues. And I don't know that those are going to change, but again, it's so heartening from a public health perspective to see this multidisciplinary group sit around the table together and talk about all of those issues together and all see ourselves as having a part in those. So that's another reason for optimism, and I think is good for us going forward. With that, I think I will stop, and we welcome your questions and comments soon.
I'm just getting things prepared for. That's all I did this up with restrictions on. She talked about a number of different items. Do either one of you have any discussion about what she talked about? Okay. At this point, we're going to throw it open to the audience. And Jim has our portable mic. I hear you pointing somewhere. Who wants to ask the first question of our speaker? No, be shy. Dr. Chen, could you explain the question? Practice and how where you against that?
So, family medicine, family practice, PCP. Oops, I'm used to talking loud. Sorry. Family practice, family medicine, primary care. So, family medicine. How about that? I think it was on the house. Yeah, I think. What's that? I'll say it one more time. So, family practice, family medicine, primary care physician. So they see everything from pediatric, well, they can also do OP, and they can see pediatric patients to adult to geriatrics. So the family residency program that's coming to Hawaii, and like I said, fully accredited, starts with the 4 students, 4 residents. They've already done medical school. So this program, this residency is 3 years. So it is about the rural track and doing rural medicine. And that does really take a very special medical student and residents to want to do rural medicine. So they have to match to us. And I don't know if you want to add to that.
No, I think the area of focus is what we need, which is also the area of long-term care and behavioral health. And so the curriculum is going to be focused on all these key specialty areas, and they happen to be our need in our community. So I think that's what makes this a part of both.
I want to add to that, but they don't just won't be at Wilcox. They're going to be across the island. So they'll get that true feel of that.
I think that the focus on so family medicine doctors do full scope primary care. It's what back in the day we used to call general practitioners, except they have more training really across the whole lifespan. So they do meet the need for primary care providers on the island. One of the beauties of this program to me is that we have these cohorts of JAPSOM medical students who have been spending much of their medical school time here on Kauai and are interested in neighbor island health, and many of them in Kauai in particular. This now provides a pathway. When they graduate from medical school, they can apply to do their family medicine residency program here on Kauai. So if they wanted to, they could do their whole 4 years of medical school and 7 years of 3 more years of residency, 7 years in total, with a focus on rural health, neighbor island health, and Kauai. And we know from national data that residents, especially in rural residency programs, are more likely to settle long-term in those communities if they've trained in those communities. So that's how this provides a real pathway to more stable primary care providers here, so that Jen can keep her eyes open when she asks you if you found problems getting an appointment.
Good. Our next question, Yanni. Wait, I did it turn. You votes on that. Ken bless. Just speak loudly, good. Okay, now speak loudly. Thank you very much for coming to us. QS. Yep. There we go. So, you mentioned Dr. Berryman looking at the upstream effects here. And I'm really concerned about the environmental health here. And major concern I have is that all of our screens, or at least 8% of them, are filled with human waste. And the science behind that showed us that even the Lihue stream right there is heavily polluted 100% of the time. What can we do about that? It's now tied into cesspools and cesspool place, which is tremendous. Probably. But health has been some of those understaffed in monitoring water quality or water leakage here, and we don't have the problems of making that invisible my walls. So I hope that the practice of health will be more helpful as we go forwards, and posting signs at those places that are forbidden.
Thank you for those comments, and I share your concerns. I agree that the environment and our climate are enormous public health concerns. And as you said, is this on? Yeah. The issue of contamination of our water is closely linked to cesspools and poorly functioning septic systems. There is, as you know, state legislation to replace those cesspools. I think the Department of Health has been, so has my workday started yet? I'm on break. There are alternatives that didn't exist when the Department of Health regulations were written, and there is work in the Environmental Health Administration to look at alternatives, ways of replacing cesspools that are less burdensome and less expensive. I think we have to look at funding for people to do that as well. It's prohibitively costly for people to replace their cesspools. At the very local level, our clean water position in the Kauai District Health Office has been vacant now for about 1.5 years. We have a volunteer sampling ocean water, but he's volunteering and he's not doing it 5 days a week like he used to. I will say that I bring this up to leadership in that division on Oahu. Unfortunately, they're the ones who are responsible for filling this position every month when I'm there and in email periodically. And I think it is paramount that we fill that position. And I'm hopeful that that will happen soon, but I absolutely share your concern and thank you very much. We're also projects that a couple people from my department who are here are very interested in is looking at the environmental distribution of leptospirosis, which is another disease contaminant in our waterways that we feel like we don't have a full handle on the breadth of the impact here in our community. So we're very interested in environmental threats as well. Thank you.
to take it. See you later, Jordan.
This is Berryman. So I wanted to ask about Tropic Care, which has been such an incredible to our community primarily from so the Department of Health, 24 instances that I was back there. It's probably a different flight now, but is there a possibility of Tropic Care back? What?
So Tropic Care is an innovative readiness training. What's the T in IRT? By our military partners, and it's a national program, and we apply for it. And we have been extremely blessed and extremely fortunate to have Tropic Care come to our island. How many times? Six times. I always get ahead of myself. During the pandemic, we had one scheduled which couldn't happen, and then we had another one. There's a 2 years. These medical missions are very complex, so there's a 2-year cycle to the application. We apply one summer, and if we are accepted, we have a mission 2 years later. So we had applied for a mission to be in the summer of 2026, and we were not selected for that. So we are reapplying now. The application is due by the end of September, and you're already submitting it shortly for the summer of 2027. We don't know what the landscape of funding like that will look for, and we do. It's been so much appreciated, and it's come so many times here that we feel like it's a regular thing. It is extremely unusual for these medical IoTs to come back to the same community more than once, and they've been here 6 months. So, we are hopeful. We are doing our best.
They want me not be prepared. Yes, on the environmental piece, of course, there's water quality and carbon, but certainly air quality too. So, and speaking of opportunities, so like the methane marine things with gas appliances, that's not good. So I'm just curious, as the island moves towards more electrification, is there a position that you guys have with air quality and encouraging that? I think there's a little bit of a Venn diagram there, right, with opportunities to, fight climate change and actually saving folks money. So I'm just curious on air pollution and indoor and outdoor thoughts on that.
So the Hawaii District Health Office does have one position that is focused on outdoor clean air. We don't have anybody focused on indoor air quality. That work does occur at the Department of Health on Oahu, and we do have access to consultation and if they bring people over here. I think that our outdoor air quality position on Hawaii, the structure of the Department of Health is a little bit hard to follow. So it's an Oahu position physically located here, but not under our administration. But there are certainly opportunities to think about expanding that work or putting you in touch with that person if you're interested. So let me know and I can put you in touch.
Okay. Notice how the statements have to be in the face to him.
I did that nervously, so you could walk out like that, coaching. Thank you so much for being here today. I wanted to say I really love the residency program, and I appreciate that you guys are trying to grow local doctors here in Hawaii. My question is, as somebody who's been through many local doctors because they just can't stay or they don't want to move here. Let's spoke about it a little bit, but what other things do you think we could be doing or that you're currently doing to house doctors, let's say to Kauai, because I feel like that's one of the biggest issues for doctors coming to Kauai and staying here is they just can't find a place to live that's affordable.
Charlotte?
Yeah, cost of living, absolutely. And it's not only physicians, it's imaging, it's nurses, it's everyone, right? So we have to collaborate on that also, and we don't have a solution for that at all.
to ensure that the community has an understanding of what we're doing so that the community can support what we're doing, there was some strong opposition to housing that had anything to do with general purpose housing. Workforce was one thing that they could support, but there was concern about what impact it would have on the community. Traffic and sanitation, when it comes to sewage, all those issues came up. And I understand, because if you live right next to the hospital, all the things that we're planning, that's a lot of disruption. So what we told the community is we would put housing in the later stages of development, phase 3, phase 4. So we're talking 10, 15 years. I think the reality is the solution is going to have to come with some acceptance of change. So, I don't know what to say to a neighbor who says, hey, Lance, I want advancement, I want a solution for our community, but not next to my house. And that's a tough one, right? And so the best we can do is continue the dialogue, continue the communication, to be sure that they understand that what we're doing is going to benefit future generations. So, I think it's going to be just work in progress. We'll see what the EIS yields. It's going to give us a lot of information. And then we're going to go back to the community with the results. And we can plan, I think, in a way that makes sense for everybody. Yeah. But I know something's got to happen. The road that we're actually proposing is the connection road from upper campus down to the highway. Everybody loves that. But if you think about it, even that construction is going to be a little disruptive. It's going to take time, but I think the end result could be very positive for the community. So again, we're going to just keep the dialogue open. That's the best we can do so that everyone's informed. Yeah. We don't want the community to be surprised and shocked with a result. So. It's making really good progress. We're right now, we're not involved in that program. I do want to emphasize something because I think this is really important for the whole team effort. Yeah, so behavioral health to me is a team sport, and it requires everybody to be at the table. So we have an effort right now. It's the Behavioral Health Advisory Committee, and it's everybody who has anything to do with behavioral health in our county involved in planning the future for behavioral health in terms of the whole continuum, the coordination of care. And we have a lot of work groups going on right now, and I think there's a really strong passion to really make this different for us. And it's going to take a lot of time. It's going to take resources, but everyone's committed, and it's a statewide effort as well. So the Department of Health is involved. All the private nonprofit agencies on Hawai are involved, and it's growing. The county's involved, because I think that's the only way for us to create a solution for behavioral health. It has to be everybody at the table. So it's a really great effort. Speaker Nakamura is behind it, and I think that's going to be very beneficial as we move forward. So
I want to take this opportunity before we run out of time to acknowledge current County Council member Mel Raposa here. Stand up, Mel. And someone mentioned Hawaii. Thank you all for coming out. We appreciate it too. Okay, additional questions. That's not, I have one. Okay, nobody else says, oh, I already decided obviously this. The good news for me was a year ago, my daughter announced that she's leaving in San Francisco area where she has a superb position, just like you, which so do I, to return home. And because she decided that after, nowadays people won't get married after a couple of years, married after many years. Sadly, they were going to get married, return home to Kauai, and they were going to start a family, which is wonderful. So what's happened is my daughter decided to go with in vitro fertilization. There's not an issue with this, she or her husband, but she had lost her youngest sister, growing sister, my daughter, of course, to brain cancer about a while ago. And we had a substantial amount of support from Boston. And so what she did, though, is we had the University of San Francisco had provided us with the genetics.
And I trained at UC San Francisco. So I'm very familiar with all the hallways that you guys walked, and with the genetics department there, because I have relied on them a lot too. And I went from UC San Francisco to LBJ Tropical Medical Center in Palo Palo in Arkansas. That was my first job that was training. So I think, LBJ is a decent hospital for where it is and for the resources it has. There are certainly places that are less resourced than that, but it was pretty much as extreme a change from the halls of UCSF as I could have imagined, and I couldn't have imagined it. And my personal journey has been between very sophisticated individual, high-powered academic medicine and primary care, and now public health. And so your question and my work span that whole continuum, right? From the economy and housing drives healthcare, drives health and well-being, and our genes drive health and well-being. And how do we distribute our resources appropriately across all of those? Very specifically for your example, the kinds of changes that are being made now in the support for scientific research in our country tremendously undermine the future of research and progress in precisely the kind of work that you were talking about. In addition, different ways of thinking about reproductive health and reproductive health technology and reproductive health access stand to threaten in vitro fertilization and people's efforts to have healthy babies. So I think there are threats all across the spectrum of health and healthcare to the entire spectrum of health and healthcare. And somebody has to say something more optimistic. But thank you, because connecting those dots is really important for all of us.
Okay, yes.
What's the truth? I appreciate that. I think the call to action is getting together like this, talking about what's going well, and looking down the path of what we need to actually improve together. I think that is very important. think it's very important to take care of yourself. It's a different world right now. It's just something going on every day. I think we all have to be strong. We have to be strong together. So what I'm going to say for call to action, I want my partner to say the same thing, is that we're very lucky to live where we live and to actually collaborate the way we do. We have to continue that, and we have to continue to help our businesses thrive. That when you thrive, we thrive. We have to continue to find a way to attract people that can move here and stay here. Cost of living, none of us can fix that. But together, there's so many rentals that people can't even buy homes. So call to action is to work together.
I agree with every point that Jen made. And I'll just add, as business leaders, encourage your employees to get involved. Healthcare is, to me, an issue that requires everyone being all in. We go to ask questions. I don't think there's any question that's off the table when it concerns your healthcare, as well as those of your loan guards. So stay connected, be involved, and ask those tough questions. I think that really leads to only positive things, because really it's a community. It's something that affects all of us in the same way. So
I want to add one more quick thing. Sorry. Our future is actually our kids. So we spend a lot of effort in the high school. We have a nurse aid program there. We have an adult nurse aid program that's totally free. We only had 5 people apply, right? Nurse aid program in high school are wonderful. They'll come and they'll be a nurse aid for a short period of time, and they're going to move on to be a nurse. But we need to invest in all of our kids on this island because we want them to get that education and stay home. That's why we have the summer internship program at Wilcox, so we can give them exposure. And they already live here. We don't have to worry about recruiting them. And we do have good paying jobs. Everyone in the high schools, so we can help our kids stay out.
Thank you, Jim. I want to answer the call to business, and then look, I see there's one more question. People spend, if they're fortunate to be employed full time, they spend at least 40 hours a week in the workplace. And if they have 2 jobs, they're spending 60 to 80 or more hours a week in the workplace. And their experience in the workplace is a big part of their overall well-being and their mental and physical health. So and employers are squeezed financially just like all of us. But anything that you can do in your workplace to support employee well-being is worth doing. Health department that would allow very young infants to be in the workplace for the first few months of their life, because we know how challenging childcare is. Am I optimistic that it will happen in time for some of our employees? No, but I think it's worth doing, and it's an example of a no-cost thing that you can do that can enhance the workplace and make it more to one for employees. On the cost side, people need living wages. People need paid sick leave. People need paid family leave. People need job security if they have unintended, life occurrences that keep them out of work. And we don't always have that for everybody. So supporting those policies statewide, even if you can't implement them in a one-off way, is really critical to that overall well-being, financial security. And we absolutely want we don't want to be focused on bringing people here and supplementing our population. We want to be focused on the people who are born here and grow up here, being able to stay here and seeing a future here that they are optimistic about. And I think that the kinds of opportunities that all of us offer for employment and educational experiences can build that. Okay.
Well, question what you per thing. So one of the things I've identified in design as a general student is then the topic and say community care when they I believe that's not for that. Let's do that here, sir. And so to that end, my free with this with us with this to for that seal we wanted to provide the here to why the comprehensive wheelchair smell with the fiber beer actually vascular a big vascular intervention. And I'd be happy to see what either skills and that in participated, but you needed kids.
Absolutely. Wound care is much needed. And that happened to be my background way back, was wound care and hyperbaric. I'm not a nurse, but that's what I did. I oversaw that unit, and it's definitely in need, and happy to talk to you.
Same here. We could do a collaboration. Okay, with that, given that it's almost 9 o'clock and we always try to start and end on a timely basis, I'm going to go ahead and call this one to a close for today. We still have speakers for the following 2 months, and so we encourage you all to return next month here. Mike, you all stay for a few minutes if anybody wants to ask questions. Okay, you saw their nod of their head. It was very vigorous. But anyway, with that, thank you very much. Good